home health is a really exciting topic and something that everybody has been really interested in. So let me start off with the purpose of this particular meeting and what we're going to do today. It is an informational meeting. So the goal is to provide you all with information about the plans for the upcoming year around different topics related to home health. This meeting is we're going to talk about the updates that we've made to our website, as well as we recently updated our frequently asked questions. And then we are going to talk about plans for rule revision and different work groups that we are going to host. Next slide, please. Okay, so the goal here, this is really important. The goals for this engagement and all of our future engagement is really to promote transparency and collaboration. We really want to work with all of our stakeholders to be engaged in all of the upcoming work around long-term home health. We want to present opportunities that are designed for stakeholders, providers alike, that allows you all to interact in a comfort level that works for you, works for your schedule, and doesn't mean that you have to miss out on specific information. And so this is really designed to help meet everybody's needs in a variety of different ways. And then also, we really want to obtain feedback and suggestions on the best way to work collaboratively to make changes and to share information about the long-term home health benefits. Next slide, please. Thank you. Okay, so first and foremost, we have made some updates and changes to our website and frequently asked questions, which is really exciting. It's been a while since we've made any changes to that portion of the website. And I think Christine or somebody will probably drop a link into the chat for me here so you all can take a look at it. We refreshed the information on it, removed outdated links, added current information about the pause that we have, and updated frequently asked questions. It sounds like we had some issues with getting that updated, so it will be done by tomorrow. And then we added additional links that included some additional helpful resources, which will be really great, and then revised the section for stakeholder engagement. And so the idea is to put on the plan stakeholder engagement on the website so that you all can see and go back and reference it from now going forward. Next slide, please. There are going to be a variety of ways that you can be involved, and we're really excited about this. And this is new and different, and so we hope that you are as excited about it as we are. As part of some ongoing efforts to really increase transparency and collaboration, we are going to be seeking a number of volunteers to work with us on a couple of different work groups. In particular, they are going to be designed so that stakeholders and providers and members can interact in a way that works for you. And then let's see here, upcoming opportunities, including the rule revision work group. I have to slow down when I say that. Rule revision together is a very difficult combination for me. So the rule revision work group, and then also the policy start work group are going to be happening not together, but they're going to coincide. And so they're going to be happening at the same time. And they're both really important work groups. And I would encourage a lot of folks to sign up for those independently because it will require a significant amount of time commitment for folks. And then in addition to that, we're going to be doing monthly policy team office hours. And so we're really excited about that. That is something brand new that we've never done before. And so we're really excited to roll that out. Next slide, please. Okay, so let's talk first about the work groups so that you all can get that information. So the rule revision work group, that one, the meetings are going to be held monthly on the third Wednesday of every month with a group of dedicated volunteers. So we're asking for people to volunteer that are going to focus in on revising the rules specific to home health. Participants are going to be provided meeting materials, which would include the agenda and sections of the draft rule at least 2 weeks prior to the meeting. So what the way that will work is for next month's meeting, 2 weeks before that meeting, there will be an agenda that will explain which sections of the rule that are discussed in that meeting. And then that also specific section will be provided to the group so that everybody has a chance to take a look at it and come with ideas and suggestions around potential changes or not changes. Updates and progress made during the work group will then be posted on the home health webpage following each meeting. During the work group, HCPF staff and the participants are going to work during the meeting to redline the document. So it is going to be an active, very fast-paced, moving. We are making changes as we go with you all during the meeting. And so we ask, and one of the reasons why we want to make sure we get materials out ahead of time with enough time for folks to look at it is so that everybody comes ready to roll, so that we can make those changes in the meeting. Again, we'll get those posted up on the webpage following each meeting. That way, if you are not participating in the work group because you don't have time, doesn't fit in your schedule, all of the things, you can see the progress and the things that the group is working on together. Next slide, please. And then in addition to that work group, we're going to have another work group. Everybody loves work groups, but the topics are too big and too important for us to be able to combine them. And so this is the hot topic. This is the elephant in the room. This is the one that we get asked about every other day, some weeks, is when are we going to restart PARS? When are PARS going to restart? How are we going to do it? We don't know how we're going to do it. And that's what this work group is for. This is going to be held. What's going to happen is they'll have the first meeting, they'll announce that, and then that group will determine how frequently they need to meet. And so the goal is this is going to be a short-term group. It is not intended to be, long, go through the summer. What we need to do is we need to work with you all as the community, stakeholders, members, advocates, providers, all critical to this group, to help come up with a plan and the best way to roll out phasing back in our PARS. We know we can't just do it all at once, and so we need to have a really structured, agreed upon approach, but we need to get that going here very soon. So this is going to be a very temporary short-term work group, just so you all know. The ideas will be presented for discussion and feedback, and then again, information, anything substantive will be posted on the website afterwards as well. Next slide, please. Still have a lot of people joining. Good news is it's being recorded. Okay, so the next piece of engagement that is different and new, and also very exciting in my opinion, is the policy team office hours. So what we're going to do is we're going to have exactly what is called office hours. We're going to have Google meetings that will be held, and Paul and Christine and whoever else from our clinical team will be there to answer questions. It'll be the second Tuesday of every month, and they will be there to offer, technical assistance, answer questions, have a conversation, engage. Like it's really a open forum. I don't want to say free for all because it's not a free for all, but it is just an open forum for you all to come to us and say, this is working, this isn't working, I don't understand this, what are we doing about that? And then you will have the subject matter experts right there to answer the questions. You can submit your questions or topics for discussion beforehand if you'd like, by emailing the home health inbox, or you can submit them through the live queue, whatever works for you. But this is going to be something that we're trying. We've never done this before, but I'm really excited about it. So I will be very interested to hear feedback on what you guys think about that. Next slide, please. And then the next new thing that we are doing around engagement is a quarterly newsletter. So what this is intended is this is really an informational dump, if you will. This is a place where we are going to provide updates on a quarterly basis around everything that is happening with long-term home health. We currently have our twice weekly email that sends out little snippets of information, and this is really intended to be a full-on newsletter. These are the 6 changes that the rural work group is working on right now. Here is a proposed timeline that the PAR Restart work group came up with. Here are some questions that have come up, several times in the office hours type of thing. So it's really meant to be informative and to keep everybody up to date in a way and in a manner that works for you. So you read the newsletter when you have time to read the newsletter, not at a specific time during a meeting type of situation. So we're really excited about that. It's going to be, new education and training topics, just a variety of different things that we're going to be putting out on a quarterly basis. They will all be housed for reference. And so each time we'll just keep adding to it. So the previous one will still be there. That'll all be on the home health webpage. All right, that was a lot of information. However, I am now going to move to our next slide, which is going to be gathering your feedback on your thoughts. What do you think about this plan? Is there any other method of communication that you think would be better, something that we missed? What do you all think about this new approach to engagement for this very, very large, important topic? And I know we have lots of very thoughtful folks on this call because I know many of you. Anybody? There we go. Thank you, Zachary. Go right ahead.
Hi, I'm Zach Newman. I'm with Developmental Pathways. I think this is a great idea. I think this is the fact that we're sending out a quarterly. I love the idea of the different work groups and the office hours. I know that we're DP is a little bit newer with our long-term home health, but having a place to go to every quarter, having meetings that we can go to in general, I think is a great idea. And I know that when I bring this to the rest of the team, they'll be really excited.
That's great. Thank you so much, Zach. Any other feedback? Anything that you all think that we missed, or any other style of communication that you think would be helpful? Very quiet today. Are my PDN folks not on? Just kidding. You guys are going to make this a very, very short meeting. No, nobody? Hey, Chris. I knew I could count on Chris.
Hi, Candace. Hi, everyone. I'm just wondering, in the process of finding out, in the midst of all of the things that we're going through in terms of the unwind for the public health emergency, is this something where anybody can join anything that they want, or are you choosing among people who are applying, or how is that going to work?
Is your question, sorry, is your question that we're choosing the work group?
Yeah. Can everybody just come and see?
I see.
What they can participate in?
Yes, so folks can come. So if you want to just join the meeting, they're open meetings. You're more than welcome to join when you can. The reason for having a specified and identified work group and the members within it is to make sure that we are able to get the materials out appropriately, and that we have a consistent group of people that are reviewing the materials and moving from topic to topic. And then we can follow up with them. But the reason for that is really to make sure that we can get the materials out to those folks specifically. But everybody is welcome to come.
Thank you so much.
Yeah, of course. Thank you for the question. And then I saw a question in the chat. Oh, I'm going to take the chat question really quick, Edward. Yes, a copy of this recording and the slide deck will be available on the website shortly. Thank you for the question. All right, Edward.
Hi, Candace. Actually, this is Irina Gorovaya with MT Health Group. Sorry, I had to switch to my husband's account to make it work, but
no problem. No problem. You threw us for a loop. It's all good.
I know, but first of all, thank you very much for doing this. I think that is long-term time coming, and I think we all feel sometimes in long-term home health or home health in period that sometimes we fall through the cracks a little bit in terms of the information sharing and engagement. So thank you for doing this and giving that opportunity for stakeholders to participate. Just a thought to maybe purposefully invite as a stakeholder, have access to CDPHE representative available, maybe somebody from the advisory committee or Stephen Cox or Erica, just so we, could be a mutual opportunity to ask questions, as well as representative from case management agencies like Rocky Mountain or Developmental Pathway. So there is an opportunity for questions and answers for long-term home health providers when it comes to PARS, communication, all different things, so we have that all-in-one resource available.
Yes, so great idea. The team has actually already reached out to CDPHE to ask them to participate as well. So we are really excited that we are going to be able to have cross-state agency participation in those meetings.
Wonderful. Thank you very much, guys.
Thank you, Irina. Jennifer.
I was just going to inquire about how to apply to be on a work group. And I see Erin put talking about future opportunities, and that the way.
Yes, Erin says yes. So there is, Erin, there is the form. Do we have the stakeholder engagement form that we can post? So for folks that want to and know that they want to participate in one of the work groups, you can fill out our stakeholder engagement form that they will post. You can also reach out to us directly and just let us know that you want to participate. So any of the HCPF staff here on this call, you're welcome to reach out to, or the home health email inbox as well. To let us know that you want to participate and which work group you'd like to participate in so that we can make sure to get you plugged into that.
All right, thank you.
Thank you so much for the question. That is an important piece of information that I definitely glazed over, so my apologies. All right, Renee.
Hi, this is Renee Klotzbach. I just had a question about accessibility. If this is going to be available for the deaf or deafblind community as well to participate in?
The work groups?
Yes.
So anybody that needs an accommodation can submit an accommodation request, and absolutely, if there's an accommodation request and a need, we can absolutely do that. And so what we would need is just it looks like, oh, Erin's putting in different information. So at the bottom of all of our agendas and on our website and several different places, there is a way to submit an accommodation request, and we definitely want to make sure that folks can access all of our meetings.
How much in advance will they need to submit that?
That is a good question. I think, Erin, thank you. I'm like, I was going to guess some numbers and they were all going to be wrong.
Hi there. Yeah, we'd like at least a week's notice in advance of the meeting if possible. Thank you.
Okay, and I had one other question.
Yes, please.
Will they at least post the link for the draft or rule that's going to be up for review in your website? So it's not just the work group, but we could actually go to if we're not in the work group, but we want to see which ones are going to be coming up. Is there at least a link or a schedule of what's coming up in case we just want a specific area that we'd like to target?
That is a really great idea. And so what we can do, and I can't see Christine, but I'm looking at her, is we can post the agenda when we send it out to the work group. We can also post it on the website so that you will know what topic is going to be discussed for the following work group. And it will also have the link to the specific section of the rule.
And then if we wanted to comment and we may not be signed up for the work group, how do we get our input to that work group?
So you can join for that particular meeting, or you can submit information, written comment to our home health inbox.
Okay.
You can email it to us. Really, it's about whatever path is easiest for you. And you are welcome to submit it in any way that makes sense for you.
Okay, thank you.
Yeah, of course. Thank you. Great questions. Any other questions or comments or thoughts on this approach for the work groups? Let's see here. Christine put the information around the reasonable accommodation. So thank you, Christine. All right. How much time is involved in the work groups? So that is a really great question. The rural revision work group is going to be held monthly on the third Wednesday for an hour. And so the time is going to be 1 hour meeting per month, in addition to the review period ahead of time of this certain section of the rule. So however long that would take you. So I would say probably anywhere from 1 to 4 hours a month of time that for the rule revision. As far as the PAR Restart work group, that group I would imagine is going to meet probably twice a month because this is a really fast paced and it's going to be very short term. probably twice a month for about an hour. So I would say 2 to 3 hours a month for that work group. You're welcome, Wendy. Thank you for the question. Renee, do you have another question?
Yeah, last question. For the quarterly newsletter, do we have to be on the list, or will it go out to everybody, or like developmental pathways and all this CCBs will have a link to it, or how would we have access to that?
That's a great question. It's going to be posted to our website. So the first one will go out, Christine, which month? Or are we planning on the first one going out?
End of April.
End of April. Thank you so much. I was thinking April, but I was like, wait, it's already April. So our first one will go out the end of this month. And so what you can do is you can bookmark our webpage and just go back and look for the updates on the work groups, the updates on our rules, all of the things. And then the quarterly website or the quarterly newsletter will be posted there directly.
Okay, thank you.
You're welcome. Let's see here. Other comments or questions. Alicia says, oh, Alicia, I appreciate that feedback. I'm glad to hear that you all are excited about the various opportunities. And then Quentin asked the current part. Oh, I got lots of things. So the current PAR pause extends through January 25. Is the goal intent to turn back on PARs in February, or would the restart work group determine the timeline? So the restart work group is intended to determine the process. So how are we going to do it? How are we going to phase it in? It would not be a switch where everybody turns back on in February. It would be, I don't know, if you live in the city and county of Denver, it's in February. And then if you live in Arapahoe, it's March. I don't know. I made that up just because I couldn't come up with a better idea off the top of my head. But so it's really just to determine the process for that. And ultimately, like by when. We'll have an end date as to when we have to have it done per federal guidelines and things like that. But we could have some wiggle room there. And then Chris says the days of the month for the PAR restart work group. We haven't determined that yet. Do we have the first one scheduled, team?
May 8th.
May 8th. Thank you very much. May 8th will be the very first one for the PAR restart work group. And from there, that team will determine the dates and the frequency that they will need to meet. And then Molly, the reason why the work group is so fast paced is because we want to get the information out quickly so that people have time to prepare. So what I don't want to do is come up with a process by December and tell everybody that they have a month to prepare. And so I really want to make sure that we have enough time to make it very clear. We have time to advertise, we have time to answer questions, and that all of our agencies and all of our members have a chance to prepare appropriately for those turning back on, because it is going to be very new and very different for a lot of people. And then Tracy asked, is there a date for the first rule revision work group? Yes, there is, and that is
The 15th.
of April?
May.
May 15th. Thank you, Christine. May 15th for that one. And all of these dates and all the information, including the links, will be posted on our website as well. So we are going to have an entire section for stakeholder engagement so that you all can go and you can check and you can see as there are new dates and new times and links that are coming up for, you know, after May, of June and July. All of that will be posted directly on our website. So you all will have access to it. These are great questions. Any other questions? Jimmy, what company will be processing the PARs once they're up and running? It will still be our third-party vendor, who is Accenture right now. You're welcome. Other questions? Thoughts? Thank you, Erin. Thank you, team, for constantly posting so much useful information in the chat. A little reminder to please fill out the attendance form if you did join late. We have that posted in the chat so that we can know who attended today and who was interested in our wonderful long-term home health project. All right, let's go to our next slide. I'm not getting a whole lot more questions. I'm trying to drag it out for you all. Just kidding. So what's next? So what we are hoping for next is that you complete the stakeholder engagement interest form. So please fill that out so that we understand what you're looking for, what you're interested in. Mark your calendars for our upcoming work groups and office hours. Again, those will all be posted, including the link on our webpage. Go ahead and check out our updated home health webpage and FAQs. They will be fully updated by tomorrow. The website is still there right now, but unfortunately we had some glitches with the system, and so we couldn't get it updated until tomorrow, but it will be there. Be on the lookout on that website for the quarterly newsletter. Again, that'll come out. Our first issue will be the end of this month, which is really exciting. And then please submit questions or requests for assistance to the home health inbox. So please let us know, what do you need more information about? What do you need more education on? What questions do you have? We use the questions and the items that come into our inbox to update our FAQs online. They're really helpful. If you have the question, I can almost guarantee you 6 other people have that question as well. And so please ask your questions, reach out to us directly. That's what we are here for. All right, next slide, please. All right, so this was a very quick meeting. Like I said, it was really intended to be informative and provide you all with the information and the plan of how we are looking to go forward. What I ask for you is for you all to participate in a way that makes sense for you, that works for you, and that if something isn't working, that you reach out to us. We're, like I said, we're trying something new here. We're really excited about it. But if something isn't working for you, or if you have additional suggestions, please let us know. We really want to make sure that we are able to reach as many people as possible, and that we get as much engagement in a variety of ways as possible. So with that, next slide, please. There it go. There's our contact information. So there's the home health inbox, again, with questions, comments, concerns, all of the things. All of us get a copy of that email, so we will get a response back to you. And unless there are any, do we have a question? Sorry, I thought I heard somebody come off mute. Unless there are any other last minute questions or comments, we can go ahead and end a little early and give you all some time back in your day. All right, not hearing any. Thank you all very much for attending. We really appreciate your time today. Have a wonderful afternoon.